Hello and welcome. My name is Beverly Popek. I'm a supervising compliance officer with the Office of Labor Standards Enforcement. And today we have a live webinar, and this webinar is being recorded, so it will be a video on demand. Today is the 18th of February, and this is going to be information effective February 26th of 2026. So a little bit about the materials and recording. The slide deck that you see here and a recording of this webinar will be posted on our website after this event. So that's something to remember and understand. You can access this information after this event. We will require a little bit of time to make the slides accessible, but very shortly after this event, you will be able to take a look at the slides presented and watch this video, as well as share it with others. That being said, if you're joining us live, thank you for joining us live. Open up the chat box. It's on the bottom right. I just released it about a minute or so ago. And in that chat box, we're going to share important information like URLs, dates, deadlines, an important point. And unfortunately, we won't be able to chat with you during the webinar. So if you have a question, please put that question in the questions and answers box. So that's how you can send us your questions in the questions and answers box. So open up the chat box, and down on the right-hand side, you're also going to see the questions and answers box in WebEx. Open that up, and we have staff who will answer questions in that questions and answers box as I am presenting today. And if your question is not answered during the webinar, staff will contact you directly with a response. So you should leave your contact information. If you're using a different email address than you use for the registration. Otherwise, we have your username and we have an email attached to it, and we will contact you that way. With that said, you are always welcome to contact our office directly through phone, email, and just let us know if we need to set up a time to meet, and we will be happy to meet with you privately after this webinar. So before we get started, I want to start us off with the background about the Healthy Airport Ordinance, and I'll be using HAO. And back in 2020, the City and County of San Francisco enacted the HAO. Then in November of 2025, the city amended the HAO to provide a new compliance method, the irrevocable healthcare expenditures method. And this was designed to provide quality standards program QSP employers with covered employees more flexibility. Now, starting on February 26, 2026, QSP employers will have 3 compliance options for the remainder of the 2026 calendar year. Now, effective January 1st, 2027, the irrevocable healthcare expenditure method will be the only way to comply with the HAO. So the goal of this presentation is really to explain this new option that's starting on February 26, 2026, where employers of employees covered by the SFO's QSP will have 3 options for compliance for the remainder of the 2026 calendar year. We'll also review the 3 options for compliance for the remainder of 2026 so that we're all on the same page because there's a lot of information. So starting it off, covered employers. Covered employers are Quality Standards Program, QSP, and employers. It's any firm, including airlines and service providers, which employs personnel involved in performing services which directly impact safety and or security at the San Francisco International Airport, also known as SFO. Now, covered employees, as a covered employer, you may have covered employees. And let's take a look at the type of work that these covered employees may do under the Quality Standards Program. So these are the types of employees who hold safety or security sensitive positions at the airport. And these employees might be those impacting security. So, for example, these are the employees directly engaged in performing checkpoint security, screening, passenger check-in activities, SkyCap and baggage check-in and handling services, and the airfield operations area. I'm going to refer to that as the AOA perimeter control. That's the airfield operations area. Now, covered employees may also be those providing ramp handling functions, including aircraft cleaning, fueling, baggage or cargo handling, as well as employees who prepare and or transport food and beverage products delivered on the AOA. Now, there could be other employees with AOA access working in and around the AOA in the performance of their duties. These are all covered employees. Now, a note about covered employees and hours. Um, there are no minimum hours requirement to qualify under the HAO. So, in other words, a covered employee are part-time as well as temporary employees. Now, the hours worked must be at SFO property, and some employees, the employees directly involved in the preparation and or transportation of food or beverage products may be located on airport property and the surrounding areas. Now, if this is a little bit confusing or you're not sure, you need clarification, and if you need help determining whether you are a QSP employer and or if you have QSP employees, contact the QSP unit directly at this information here. This is their email address, their phone number, and their website. Now, moving on to compliance options under the HAO. As mentioned prior, effective February 26, 2026, an employer may comply with the HAO by selecting one of the three options. So these first two options that I'm going to go through and list here are current options that if you are currently operating and complying with the HAO, these are methods that you're familiar with. Number one, offer compliant or qualifying family health plan, or option two, pay the monthly city option contributions, or this is the new option, the third option, make irrevocable healthcare expenditures based on each employee's household size and hours worked. So that is the new option. So before we get into that new option, which we'll spend a lot of time on in this particular presentation, we're going to review the first two options so that we're on the same page. Now, option one is to provide each covered employee a family health plan that includes the employee's dependents that meets the health plan requirements. Now, the health plan requirements include it must be at no cost to the covered employee, and the actuarial value is equivalent to a platinum level plan. It also provides comprehensive coverage for benefits listed in the California Essential Health Benefit Benchmark Plan. And in terms of eligibility, coverage, when does it start? Coverage must begin on the first of the month that begins after 30 days from the start of employment. And this particular information is a given. It's for every single option that we have here under the HAO. Coverage, you got to comply by the first of the month that begins after 30 days from the start of employment. Now, what about buy-ups? Employers may offer different plans, and buy-up options are allowed. So once an employer offers the platinum level plan and that is satisfied, the employer may also offer additional gold level plans. And at that point in time, the employer may require the employee to pay a contribution, a deduction towards the gold plans or the buy-up. Now, the cost is limited to the difference between the employer's premium cost of the most expensive platinum plan and the employer's premium cost of the gold plan or gold plans. Now that was the first option. Let's move on over to the second option, which is payment to the city option. So you have choices. You as the employer, you get to choose how you'd like to comply with the HAO. And if you'd like to comply with option one for everyone, or maybe part of your workforce, the people who work 32 hours or more, for example, a week, and then you want to comply with this option two for others, this is up to you. So what this is, option two is payment to the city option. And you just employers make payments to the city option, and there's a rate. So effective July 1st of 2025, the city option rate is $12.15 per hour worked at or near SFO property. And there is a maximum cap of up to $486 per week. That's 40 hours. Now, that's the weekly cap of 40 hours, and the rate is updated every July 1st. Now, FYI, the new rate for July 1st of this year, 2026, will be available in May. So stay tuned for that if this is a particular compliance option that you are using, you like to use, and the rate is going to change. More about payment to the city option. This is a monthly payment, and it's due by the 15th of the month for hours worked in the preceding month. Contact the city option to set up an account and to make reports and payments. And please mention that you are an SFO employer. And the city option is not our department. It's not OLSC. This is a separate entity that you will contact to create that account and make payments. Another best practice or thing to keep in mind is that you should inform your employees in writing when you have made the first payment and what to expect. Now, here are some resources for option one and option two. On the left-hand side, we have some resources for option one under the Family Health Plan. You can take a look at our HAO website for more information about what's a qualifying health plan, what's a compliant health plan under the frequently asked questions. We also have on-demand videos for the HAO health plan requirements if you are interested under that option one. And moving on over to the right-hand side under option two, the city option. This is the city options a website, email address, employer services at sfcityoption.org, as well as their phone number. Now that we've learned and reviewed the current approaches or options for HAO compliance, let's turn our attention to option three. This is the new option that is available as a compliance option on February 26, 2026. So starting February 26, 2026, QSP employers will have this new option to make irrevocable health expenditures based on a covered employee's household size and hours worked at or near the airport in a QSP capacity. And we're going to dive into all of that in the coming slides. So just be patient and we will define a lot of what that means. But important to understand is that on January 1st, 2027, this tiered irrevocable expenditure method that we're reviewing today will be the only compliance option. In other words, the option 1 and option 2 that we just quickly reviewed will not be options anymore. You can't comply with the HAO with those options. This particular option, the tiered irrevocable expenditure method, will be the only way effective January 1st, 2027. And this gives covered employers most of 2026 to either maintain their current approach or transition to the new system. So let's dive in. The most essential requirement for this option is for employers to satisfy the spending requirement. And here are the tiered expenditure rates, which sets minimum spending levels based on each employee's household size. Household size is determined by the number of healthcare dependents an employee has. And we'll get into the definition of healthcare dependents very soon. So let's take a look at this chart for employees with no dependents. The rate is $6.17 per hour with a maximum cap of $246.80 per week. For employees with one dependent, the rate is $12.33 per hour with a maximum cap of $4.93 per week. And then for employees with two or more dependents, the rate is $17.44 per hour with a maximum cap of $697.60 per week. Now, this is all at 40 hours max per week. And something very important at the bottom of this slide to keep in mind is that the healthcare expenditure rates change annually on January 1st. That means on an annual basis, the Department of Public Health will review the rates and will adjust the healthcare expenditure rates, which will change annually on January 1st. But these are the rates for 2026 until December 31st of 2026. Now that you understand that the expenditure rate is based on an employee's household size, you're probably wondering who is defined as a healthcare dependent. So healthcare dependent means a QSP employee's spouse or registered domestic partner, child, including any legally adopted child, recognized natural child, stepchild, foster child, and minor legal ward who is eligible for coverage, and any other dependent entitled to be covered under employer provided full family health care plans under federal laws or California state law. Now, once you know your employee's household size, then you need to determine the weekly expenditure amount for that particular employee. Now, remember that this is a requirement that is weekly. And this particular slide uh, is an example of how to calculate the weekly employee expenditure amount. And essentially, the formula is that you multiply the expenditure rate by the employee's hours worked to determine the weekly expenditure amount. So let's look at an example. And for this example, we have an employee with one dependent. So going back to that chart, which I'm not going to show you, the rate for employee with one dependent is here on this slide, where the rate is $12.33 per hour for that employee with one dependent. Now let's say that employee works 38 hours a week. So we have the rate information, we know how many hours that employee works. So essentially what we do is we take the hours worked, 38 hours work, and multiply it by the rate, which is the household rate of $12.33 per hour, to figure out and determine what is the weekly employee expenditure amount an employer would have to spend. And that amount, that is it's $468.54. So that is how you would calculate the weekly employee expenditure amount. And something to keep in mind, this method of calculation, you use the hours worked. Count the hours worked on SFO property in a QSP capacity. Now, hours worked elsewhere in the world or at home do not count as covered hours for the HAO. And then there is a carve out for purposes of the QSP employees who are involved in the preparation and or of the transportation of food and beverages delivered to the aircraft on the AOA. You will count those hours worked at or near SFO property. But take a look at the hours worked, and you will be able to calculate that weekly employee expenditure amount. Now, once you know the weekly expenditure amount, as we went through on that previous slide, you need to start thinking about how an employer can meet this expenditure amount through irrevocable healthcare expenditures. And to understand this, we need to look at the definition of irrevocable healthcare expenditure. So let's take a look here. What is it? What is a irrevocable healthcare expenditure? It's any amount of healthcare expenditure that has not been retained by or cannot at any time be recovered by or returned to the employer. Now, for self-funded or self-insured health plans, the actuarial value of the benefit offered may be treated as an irrevocable expenditure. So, what counts as healthcare expenditures, you're probably thinking? In some, it's all about an employer providing or reimbursing the cost of healthcare services through different ways. So, let's take a look at this. Healthcare expenditures may include amounts paid to perhaps a trustee or third party on behalf of a QSP employee for the purpose of providing or reimbursing the cost of healthcare services for an employee and their dependents. It can also be an employee or for the purposes of reimbursing the cost of healthcare services for the employee and their healthcare dependents, or it could be this the city on behalf of a QSP employee to establish or to contribute to a medical reimbursement account, like an MRA, administered in accordance with SF labor and employment codes. So some notes about healthcare expenditures for self-funded plans. Healthcare expenditures for self-funded plans may include premiums and or fees paid by the employer to a third party to administer the self-funded or self-insured plan. It may include claims paid out of pocket by the employer for the specific worker, and it may include the actuarial value of the benefits offered by the employer as determined for setting rates for COBRA under federal law. Again, healthcare expenditures is all about an employer providing or reimbursing the cost of healthcare services through different ways, and you get to choose. But what is the definition of healthcare services? So this slide really unpacks it, and healthcare services means medical care. Services or goods that may qualify as tax-deductible medical care expenses under 26 USC 213, or those having substantially the same purpose or effect as such deductible expenses. Now, for the purposes of the term medical care, it means amounts paid for the diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purposes of affecting any structure of the function of the body. Now, based on that definition of healthcare services, let's look at some examples of healthcare expenditures. It can be payments or contributions to a trustee, third party, healthcare provider, or employee to provide or reimburse for medical, dental, or vision insurance. It can be payments or contributions on behalf of the covered employee to the SF City option, and it can be payments or contributions on behalf of the employee to a reimbursement program. And these are just some examples. There's a lot of different ways here that meets the healthcare expenditures. And let's take a look here at some more. It can be payments or contributions for qualifying medical expenses such as dental treatments and fees paid to dentists for x-rays, fillings, braces, extractions, dentures, eyeglasses and contact lenses needed for medical reasons, fees or eye exams, and eye surgery to treat defective vision. Now that we've looked at some examples of what it can be, let's take a look at healthcare expenditures and what they don't include. They don't include any amount otherwise required to be paid by federal, state, or local law. It does not include any amount funded by deductions from an employee's pay, does not include any amount paid directly by an employer to an employee that is not related to a documented expenditure for healthcare services. And then payments made directly or indirectly for workers' compensation or Medicare benefits do not qualify as healthcare expenditures. Now that you understand that there are healthcare expenditures and healthcare services, let's remember again that the HAO requirement is about having that employer satisfy the employer spending requirement for employees. And again, there's good news that there are so many ways to satisfy the employer spending requirement. And let's take a look at some of these options and ways that you can do that. And the first example or option here that's listed to satisfy the employer spending requirement is health insurance. Health insurance is the most common way, and employers often pay medical, dental, and vision premiums to satisfy other legal obligations or attract and retain employees. So if you spend money on insurance, you will need to look how much that costs you, the employer. Then see if the employer's cost meets the employer's spending requirement. So you'll have to take a look at that, and you'll have to know, of course, the employer's spending requirement per employee based on household size. And understanding what that requirement is for that employee based on the hours worked per week. Now, any payments that the company makes for medical, dental, or vision insurance for the covered employee and their dependents all count toward the employer's spending requirement. So let me say that again. It's not just the employer's spending towards the covered employee, but it's also the employer's spending towards the covered employee's dependents as well. And I want to emphasize that it's only the employer spending that counts towards meeting that or satisfying the employer spend requirement because employers can require employees to pay some of the medical care services or premiums. And if that is the case, if that is what is being done, that's fine, but the employers cannot count anything employees pay. It's only what employers pay that goes towards the employer spending requirement. Now, here is another way of meeting the employer spending requirement. And it's really about maybe a health, it's about like a San Francisco city option, which is managed by the San Francisco Public Health, not OLSC. You, an employer can contribute to a health savings account, medical savings account, or other irrevocable reimbursement account. Now, keep the word irrevocable in mind, and that's underlined here, as again, that means that the money does not return to the employer. So once an employer spends what they have and they're required to on the employee, that money does not return back to the employer. Now, with that understanding of irrevocable, you, employers cannot count flexible spending accounts, FSAs, because those accounts are use it or lose it. Now, employers can utilize a combination of all of these options to comply, not just the options on this particular slide with what is this SF city option, health savings account, a medical savings account, et cetera, but everything including some sort of health insurance in combo with all of these discussed here. Um, so that is really the flexibility and great part about it. It also can be complicated, but we're here to assist you and we're here to help. Now, let's turn our attention to the situation that may occur if or when an employer offers a health plan and the employee wants to waive the offered health plan. And this information is relevant to our current option number 1 and the new option number 3, which you're learning about today. So a covered employee may voluntarily waive the health plan offered under option 1 or option 3 if they execute the official OLSC voluntary waiver form. And the voluntary waiver form, because we have a new option coming out on February 26, will be released on the HAO webpage on February 26, 2026. And that is the official and only voluntary waiver form that an employer can use from February 26 on. So you got to get that voluntary waiver form if that's the case, and the employee needs to execute all of the sections there on that voluntary waiver form. Another important thing to keep in mind, and this is important for employers, is that there must be proof of current coverage for the employee and dependents. That is the only way that an employee can voluntarily waive out of the health plan offering. As a reminder, the waiver is not available for option 2 because that's a city option, pay as you go method, and this waiver form is only for option 1 and option 3. And the waiver is valid for the health plan year and is required on an annual basis. Now, let's take a look at this here, more about the health plan waiver as it has to do with option 3. If an employer offers an employee a health plan, medical insurance, for example, and the employee signs a voluntary waiver, the employer may deduct the amount of the premiums that the employer would have paid if the employee accepted the coverage offered from the health plan. So this is something to keep in mind. If you have offered something, if the employer has offered something and the employee has signed that voluntary waiver and provided proof, the employer may deduct the amount of the premiums that the employer would have paid if the employee accepted the coverage offered from the health plan. This is, you must count that towards your spending requirement, or you don't. You may or you may not. It's up to you. An employer must retain a copy of the form and documents for 3 years after the termination of your contract with SFO. So that's just a requirement of how long you should retain information. Um, Now, more about the health plan waiver as it has to do with option 3. Um, when you offer, if an employer offers that health care medical plan, the only reason um, an employee can use the voluntary waiver form um, is having another coverage from another source and they have decided to waive it and they have proof. And you can, once you use the official voluntary waiver form, the employer may apply the credit towards the employer spend requirement. Now, this is something to always remember. What is the employer trying to meet? What is that amount? And the employer remains responsible to make irrevocable healthcare expenditures for the remaining amounts that are not covered by the waiver. That's if any. So that's something to really remember about this. The spending requirement, what is that amount? It's all based on the employee's household size, and hours worked in a weekly basis. Now, more about the HAO waiver form requirements. The declination reason. The only reason that they can decline, the employee can decline, is that if the employee has health coverage from another source and they would like to decline the offering. So the employer must complete the employer portion of that voluntary waiver form if it's going to be used, and of course have the employee voluntarily complete the employee section, sign the form, and employers must collect proof of supporting documents or documents showing that the employee and their dependents have current coverage from another source. Now, moving on to other types of healthcare expenditures under this new option 3. Um, Employers can make contributions to a medical reimbursement account, MRA, and if that is how an employer is going to comply under option 3, this would be made through quarterly payments. So employers must make that payment to the account within 30 days after the end of the quarter in which the employee worked the hours. So let's take a look at this. The year is divided into quarters, January through March, April through June, July through September, and October through December. The employer tracks the hours worked in each quarter, and after a quarter ends, the employer has 30 days to send the required payment to the account. Deadlines. So the expenditures must be made within 30 days of the end of the quarter. Now, there are exceptions for self-funded health plans which are calculated annually. And here are the quarterly deadlines. Quarter 1, deadlines April 30th. Quarter 2, July 30th. Quarter 3, October 30th. Quarter 4, January 30th. So let's take a little deeper dive into this. Remember, I always said that the employer needs to be always thinking about satisfying, meeting that employer spending requirement. What is that amount? And let's just say, for example, in the month of March, the employer is looking and needs to look at how much they've spent for that month. And what if they discover that they have not fulfilled the spending requirement for all their covered employees? There was a plan, but somehow that's the case. Now, the employers can make additional expenditures if needed. and they have an additional 30 days to either make a contribution to their HSAs, perhaps the San Francisco City option, or another irrevocable reimbursement account to comply with the monthly deadline. So this is something that everyone always needs to be thinking about, employers, the spending requirement and at least meeting that and how you're meeting that. Now, let's look at this. The CBA waiver, collective bargaining agreement waiver is allowed. With the recent November 2025 amendment, a collective bargaining agreement waiver is allowed. Some things to keep in mind if you have such a waiver, it needs to be clear that the waiver is specific to the Healthy Airport Ordinance, HAO, and a waiver can't be backdated to cover the past. It's moving forward. And yes, if you have a waiver that explicitly spells out it's for the HAO in your collective bargaining agreement, this means that you don't have to comply with the HAO requirements. Let's take a look at an employer's notice requirements. The employer is responsible for providing existing and new QSP employees with current Know Your Rights form and posting the operative poster that explains the employer's HAO obligations. So this is super important because we have this new method, which we've been talking about, this option 3. There's going to be a new notice that you have to post, as well as new Know Your Rights form, and they will be available on our website on February 22nd, 26, 2026, and they will be effective until June 30th, 2026, as there will be a new poster and forms issued for July 1st, 2026. So I'll say that again. You need to come to the HAO webpage, the OLC website, download the poster, the notice, and the forms, the Know Your Rights forms, on February 26th and post it and provide the forms to existing and, of course, new QSP employees who may come into your employ in the coming months or so. But come July 1st, there will be a new poster and forms issued because the rates will change. Now, this requirement is pretty straightforward. The employer needs to keep for a period of 3 years after the termination of the city contract with SFO records. Now, examples of records that you should keep would be information about hours employees worked, healthcare expenditures made, including insurance enrollment, invoices, any HAO waiver forms, if any, and anything else you need to demonstrate compliance. So payroll records showing start and end dates, maybe if you're using the city option and you have city option contributions. There are so many things that you can keep here, and you don't need to keep physical files, just keep it up in the cloud. So moving on to some common compliance issues to bring to your attention. One of the common compliance issue that employers may run into is not calculating the spending requirement correctly. This this is the amount that's based on hours worked, not hours paid. And if you are currently complying with the HAO by option 2, paying to the city option, you understand that this is based on hours worked, not hours paid. So please take a look into that, and you will avoid that particular issue. Now, moving on over to another common compliance issue to bring to your attention is that if you're making expenditures but not at the correct household size. So you need to find out from your employee their household size and have that information. If you don't have that, you really can't calculate what your weekly expenditure requirement is. It's impossible. So you need to know what is the household size. And this is a third item to bring to your attention about a common compliance issue. Failing to make any healthcare expenditures for anyone. So, disregarding part-time workers or workers that you may define as not eligible for benefits. The HAO has a definition that there are no minimum hours. So, if they're working, you need to comply with one of these particular methods or approaches. So take a look at all employees who are working for you and comply in a manner that you'd like. And you get to choose how you'd like to comply, not the employee. Now let's turn to some frequently asked questions here. And this particular question is about offering insurance. And if I offer insurance to my employees, is that enough to comply with the irrevocable healthcare expenditure method? And this is the new compliance method that's going to be available on February 26, 2026. So, the answer it depends. So number one, the employer must ensure that first, the insurance is sufficiently comprehensive to satisfy the expenditure rate for that year. And second, that all covered employees are enrolled in the plan or have signed a voluntary waiver form and have provided proof of current health insurance. And then as a reminder, for waivers, the employer may receive credits for the premiums it would have spent on the health plan if the employee had accepted the coverage. If the amount does not meet the expenditure rate, the employer must find another expenditure method to cover the difference. And that last sentence, that last point that I said, if you, the employer, have determined you have not met the expenditure requirement, you must find another method to cover the difference. So that is something to take away today as a point. Now, let's move to a second question. It seems it's related. It has to do about under the irrevocable healthcare expenditures method and health insurance. So under the irrevocable healthcare expenditures method, do I need to make expenditures for employees who already have health insurance from another source? So let's take a look at the answer here. And this is another, it depends. If you're offering health insurance or a health plan and an employee declines the offer of health insurance because they have insurance from another source and they voluntarily complete the official waiver form and submit the supporting proof of current coverage, then the employer may deduct the amount of the premiums that they would have paid if the employee accepted the coverage offered from the health plan. That is an option for the employer to do. Now, the employer remains responsible to make irrevocable healthcare expenditures for the remaining amounts that are not covered by the waiver, if any. So that is the answer for that particular situation. And it's all about tracking and making sure that you as an employer understand what that spending requirement is and figuring out if you've met it. Did you satisfy it? And if you didn't, making other expenditures to meet it. Now, moving on to another question. Will the city option rate increase on July 1st, 2026? And this is currently option 2 that's available for the remaining calendar year of 2026. And yes, the answer is yes. The city option rate will increase on July 1st, 2026, and the new rate will be published in May of 2026. And the best way to get this information is to check our HAO webpage. Once we have this information, we publish it. We put it on our webpage, our website, and the second way or best way to get this information is to sign up for our email newsletters to be notified about information like this. So this is the URL to sign up for our email newsletters for HAO. You will also receive MCO and HCAO information, and this is a great way to stay in the loop with any rate updates and other updates directly related to the HAO. Now let's turn our attention to another question here. Can an employee require an employer to provide a particular compliance option? For example, can the employee require employers to pay contributions to the city option? And the answer is no. The employer decides on the compliance option, not the employee. So, as an employer, you decide and make it a consistent implementation for your employees. And that could be made for, say, employees who work 32 hours or more, one particular method or option. For other employees that work a certain number of hours, it could be another option. Um, just you figure out how you'd like to comply and let the employees know so there's not a lot of questions about how you will be complying with the HAO. But you get to choose the employer on how you'd like to comply with the HAO. Here's another question about hours worked. Um, do hours worked outside of SFO count for the purposes of calculating health expenditures? So the answer is that this is usually the time your employee works on SFO property. However, there's an exception to this where catering companies who prepare food for airlines, beverages, work for airlines, these companies may have QSP employees who perform work near SFO, and in other words, not an SFO property, and these employees are covered. Now, if you have any questions about who are your QSP employees, if you have them, and to determine who they are, contact the QSP unit. If you have questions about compliance, please contact our office. Now, finally, this is our contact information for the Office of Labor Standards Enforcement. The HAO, Healthy Airport Ordinance, is administered by the Healthcare Accountability Ordinance Unit, and this is our direct webpage to the Healthy Airport Ordinance. And on this webpage, on the February 26, 2026, you will see all of the new forms, the Know Your Rights form, the health waiver form, as well as a notice or poster right there for you. We will have the English version readily available, and in the coming month or so, we will have translations in Chinese, Filipino, and Vietnamese, and did I say Spanish? Okay, so we'll have the other languages available shortly soon. These are our email addresses. You can always email us there, And we have a phone number. We pick up the phone. You can always give us a call. Now, if you have a lot of questions, you think that you might need a little bit more time, send us an email, send us a few good times, and we can coordinate a time to meet with you and others to go through and get you answers to your questions and to assist you. I want to thank you for attending this webinar live, and I know that some of you may be watching this recorded. I'm going to also thank the OLSC staff, Jade San Diego, Giselle Omedo, and Sally Chin, for helping us get you answers and providing information. We look forward to assisting you, and we thank you for your patience as new information, forms, and everything will be available on February 26, 2026. Thank you very much.